Created more than 10 years ago, the Children's Health Insurance Program has been a lifeline for millions of children whose parents work full-time and don't qualify for Medicaid, but through no fault of their own don't have and can't afford private insurance. For millions of children who fall into that gap, CHIP has provided care when they're sick and preventive services to help them stay well. This legislation will allow us to continue and build on these successes. But, as I think everybody here will agree, this is only the first step. The way I see it, providing coverage to 11 million children through CHIP is a down payment on my commitment to cover every single American. And it is just one component of a much broader effort to finally bring our healthcare system into the 21st century. That's why the Economic Recovery and Reinvestment Plan that is now before Congress is so important. And think about this. If Congress passes this recovery plan, in just 1 month, we will have done more to modernize our healthcare system than we've done in the past decade. We'll be on our way to computerizing all of America's medical records, which won't just eliminate inefficiencies, won't just save billions of dollars and create tens of thousands of jobs, but it will save lives by reducing deadly medical errors. We'll have made the single largest investment in prevention and wellness in history, attacking problems like smoking and obesity, and helping people live longer, healthier lives. And we'll have extended health insurance for the unemployed, so that workers who lose their jobs don't lose their health care too. Now let me say this. In the past few days, I've heard criticisms of this plan that frankly echo the very same failed theories that helped lead us into this crisis in the first place. The notion that tax cuts alone will solve all our problems, that we can address this enormous crisis with half steps and piecemeal measures and tinkering around the edges, that we can ignore fundamental challenges like the high cost of healthcare and still expect our economy and our country to thrive. I reject these theories. And, by the way, so did the American people when they went to the polls in November and voted resoundingly for change. So I urge members of Congress to act without delay. No plan is perfect, and all of us together, Democrats and Republicans, should work to make it stronger. But let's not make the perfect the enemy of the essential. Let's show people all over our country who are looking for leadership, who are desperate for leadership right now, that in difficult times, we're equal to the task. Let's give America's families the support they need to weather this crisis. In the end, that's all that people like the Secrests are looking for. The chance to work hard and to have that hard work translate into a good life for their children. Now, I'm pleased to report that the Secrest story had a happy ending. It turned out that Gregory's 2 sons were eligible for S-chip, and they are now fully covered, much to his relief and his wife's relief. I think Gregory put it best when he said, "Kids, look at us and think that we will take care of you." Every parent here has that experience. You look at your children and you know that they're looking back at you and they're saying, "You're going to take care of me, aren't you?" That's our job, to keep them healthy and to keep them safe and to let them dream as big as their dreams will take. That's what I think about when I tuck my own girls into bed each night. And that's what I want for every child, every family in this nation. That's why it's so important that Congress passes our recovery plan so we can get to work